we are talking about hyperbaric oxygen therapy. We've got the expert here at Trinity Health, Dr. Steven Zonka. Thanks so much for joining us today.
Thank you, Michelle, for having us.
So let's talk about what this is. It sounds like something from the future, but this is happening here every day.
It is. We use hyperbaric oxygen to treat chronic wounds, especially diabetic foot infections, also radiation-associated injuries, osteoradionecrosis, or radiation injuries from therapeutic treatments. There are other for example, infectious processes can be treated with hyperbaric. Hyperbaric oxygen therapy was actually started with treatment for the diving injuries, the bends, and it's been shown to have some very beneficial effects in these chronic wounds that don't respond to our normal everyday treatments that most patients get better with routine therapies. But for those patients who have special needs, then we have this extra tool in our toolbox to help them recover more fully.
Okay, so let's talk about what it looks like to be going through this kind of therapy.
So it's a clear acrylic chamber. Patients are in that for about a little over 2 hours, and they're pressurized, much like when you go in an airplane. You have to clear your ears. We send you in with a little water bottle to clear your ears, and we pump in 100% oxygen under pressure. We have special clothing for patients to wear, and so that there's no flammable materials allowed in the chamber, and then that high oxygen helps deliver the healing potential to those areas that are challenged either by radiation or by chronic infection or possibly even poor blood flow to help heal these challenging wounds.
Okay, and so how long will that therapy normally last before you see results?
Typically 4 to 6 weeks is the treatment, 5 days a week for the treatment. And during the treatment time, patients can watch videos or watch TV. We have a TV screen right above the chamber. They're laying in a relaxed position, sort of back up about 30 degrees. So we've got wedges and such to make patients comfortable with if they need their knee bent or their back up a little bit more. It's the temperature is controlled, and so they can communicate with us. We have a microphone so they can talk with us during the treatment to make sure that they're comfortable throughout the treatment.
Wonderful. Yeah, go in and take a nap, right, if you'd like.
Most patients watch a TV show, or they can bring in a video DVD if they're watching a series or something like that, but we also have TV there for them to watch also if they wanted to catch up on the news or the latest show.
There you go, on the morning mix, right?
Take care of the morning mix.
All right. So let's talk about the results that you see for patients with this.
So again, these are for patients who are resistant to the normal avenues of healing, and so we've had some very good results. You know, these are limb-saving procedures, saving a foot from a diabetic foot wound. Patients who've had radiation and haven't healed after a dental extraction, we can save them from a disfiguring jaw injury. So these are really very rewarding when we have these great results.
Wonderful. And obviously this is something that they would be referred to from their other physician.
From either the primary care to the wound clinic. We do receive referrals directly from specialists who are treating these associated injuries, and we're coordinating through the wound clinic so that we're able to identify and coordinate the care of these patients.
Wonderful. Well, Dr. Zonka, thank you so much for your time today. We really appreciate it.
Michelle, thank you, and hopefully this will help spread the word about some of the advanced treatments that we have available for wound care in the Muskegon community.
Well, we are very grateful you're here.
Thank you.
Thank you.